اوكي، زي ما اتفقنا احنا هنتكلم في اي disease عن الاتيولوجي والميكانيزمز والpathological changes. So in cell injury we are going to explain the causes and the mechanisms of cell injury in this lecture. By the end of this lecture you will be able to list the causes of cell injury, determine the factors responsible for the state of injury of the cell, explain the different mechanisms of cell injury, which is the pathogenesis of cell injury. What are the possible causes of cell injury? Think and answer. يا ترى ايه اللي ممكن يعمل cell injury? We have a long list of causes. We may have genetic defects. يعني ممكن يكون السبب genetic أصلا من الأول or maybe acquired. So we have genetic defects and acquired causes. These acquired causes can be oxygen deprivation, نقص الأكسجين زي نقص البنزين, chemical agents, physical agents, nutritional imbalances, infectious agents, and immunologic reactions. So these are the causes of cell injury. Start with genetic defects. Genetic defects, we have an abnormal gene. So this abnormal gene may result in enzyme deficiency in the form of inborn errors of metabolism. So one enzyme is deficient, so the reaction mediated by this enzyme will be lost. We are going to have a substrate that is not metabolized by this enzyme, and so we are going to have a defect in the outcome of this process, leading to a lot of problems and cell injury. Accumulation of damaged DNA is another cause that may lead to cell injury in certain cases. For acquired causes, we may have nutritional imbalance, and this nutritional imbalance may be increase or decrease. So we may have nutritional deficiency or nutritional excess. For nutritional, we may have nutritional deficiency or nutritional excess. Nutritional deficiency, the diseases of nutritional deficiency may be related to protein deficiency or calorie insufficiency, all over deficiency of both calories and proteins, or vitamin deficiencies. So the nutritional deficiency may be in one factor or in one nutritional constituent as protein, calorie, vitamin, or mix it together. Or we may have a nutritional excess. Nutritional excess can also cause cell injury. Obesity in the form of nutritional excess can lead to cell injury. It can predispose the patients to develop diabetes mellitus, atherosclerosis, تصلب الشرايين, heart diseases, especially ischemic heart diseases, and hypertension. So obesity can predispose the patient to this group of diseases: diabetes, سكر, atherosclerosis, تصلب الشرايين, heart diseases, ischemic heart diseases, and hypertension اللي هو الضغط العالي. Physical agents that can lead to injury include trauma, temperature بالزيادة أو بالنقص, high temperature or low temperature, radiation, electric shock, atmospheric pressure, low or high. So these physical agents can lead to injury. We can have chemical agents in the form of poisons, السموم, organic and inorganic environmental agents, therapeutic drugs, and the therapeutic drugs are very important. هو سلاح ذو حدين. أي drug ممكن يبقى مفيد وممكن يبقى له ضرر. So the therapeutic drugs can lead to cell injury. Infectious agents, microbes, viruses, bacteria, fungi, parasites can all cause cell injury, of course. Immunologic reactions in the form of hypersensitivity reactions or autoimmune diseases in which the immune system attacks our own cells, leading to injury, as in cases of rheumatoid arthritis, in case of systemic lupus erythematosus, and so on. Oxygen deprivation or hypoxia, and hypoxia is a very important cause of cell injury. Oxygen deprivation or hypoxia means reduction in the amount of oxygen delivered to the cells. So hypoxia means decrease in the amount of oxygen delivered to the cells. If you go to see the circulation of oxygen from the air until it reaches the cell, you are going to identify the causes of hypoxia. First, the oxygen is present in the air. It enters the body through the respiratory system, through the lungs, where gaseous exchange occur in the lungs. So you need good lungs for gaseous exchange. Then from the lungs, the blood goes through the pulmonary veins to the heart, left side of the heart. And then it is distributed through the aorta. This is the oxygenated blood, of course, through the aorta to different organs until it reaches the cell. The oxygen is carried by hemoglobin on RBCs. So I have the RBCs present in the blood. They contain hemoglobin, and this hemoglobin carries oxygen, and then they go through the blood vessels to reach the organs. So you need a blood vessel, good blood vessel, to reach the organ. Okay, this cycle from oxygen in the air till it reaches the organ, the cells of a certain organ, we need good respiratory system, healthy lungs for gaseous exchange. You need good RBCs with enough hemoglobin that is ready to carry the oxygen, and you need good circulation so that the blood circulation is good, arterial supply going to the organ is good. Fine. If you have defect in any of each steps, you will have defect in the oxygen delivered to the tissue. Starting with the lungs, if I have a respiratory system and this respiratory system disease leads to decreased oxygenation, decreased gaseous exchange, this will lead to hypoxia, and distributed through the aorta, there will be a problem. So if I have a lung or heart disease, I'm going to have decreased blood oxygenation. Next, look at the RBCs. If I have good RBCs, it's okay. I may have defect in the RBC number, so the RBCs will be diminished in number, or the amount of hemoglobin inside the RBCs is diminished, so decrease hemoglobin, or this hemoglobin is occupied by another thing that they can't carry the oxygen, okay? And this occurs with carbon monoxide. Carbon monoxide is a toxic gas that is produced during burns. If I have some burn somewhere, you can have a lot of carbon monoxide. This carbon monoxide goes and binds to hemoglobin, and it has more affinity than oxygen. So it competes with oxygen for the hemoglobin, and this will lead to decrease oxygen carrying capacity of the blood. So decreased oxygen carrying capacity of the blood may result from either decrease in the number of RBCs or decrease in hemoglobin amount, and this is case of anemia, severe anemia. Or I have carbon monoxide poisoning, in which the oxygen cannot compete with it for hemoglobin, and so the RBCs cannot carry oxygen, and this is called decreased oxygen carrying capacity of the blood, and this will eventually lead to hypoxia of the cells. Lastly, if the oxygen coming from the lungs and heart is okay, and the RBCs are carrying the oxygen okay, but I have some defect in the blood supply of the organ, I have some arterial obstruction. This will lead to decreased oxygen delivered through these stenosed or narrow blood vessels to the organ, and this is the cause that is named ischemia. So ischemia means diminished blood supply to the organ due to some obstruction or some narrowing of the arterial blood supply of the organ. All these causes together will lead to hypoxia or oxygen deprivation with reduction of amount of the oxygen delivered to the cells. Think and answer. The response of different types of cells to an injurious stimulus is identical. True or false? Of course, it's false. We have different responses of different types of cells to a single injurious stimulus. If I have one injurious stimulus affecting different cells, I'm going to have different responses. Why? Because there are factors that control the cellular response to injurious stimuli. Some factors are related to the injury, and some factors are related to the cell. Regarding the injury, the type of injury, duration of injury, and severity will modify the cellular response. So if I have just brief, very long, short period of ischemia may lead to reversible cell injury, while longer ischemic intervals may result in cell death. So the duration of ischemia, which is the diminished blood supply to the organ, the duration is important. If it is short, it can lead to just to reversible injury. But if it is prolonged, it will lead to cell death. The severity, if the injurious stimulus is mild, we can have reversible cell injury. But if the severity is high of injury, of course, is different. If I have a chemical injury, it is different from oxygen deprivation, it's different from poisons, and so on. So the type of injury, duration, and severity will modify the response to injurious stimuli from reversible injury to cell death, and so on. Other factors are related to the injured cell. The type of the cell, its status, adaptability, and genetic makeup of the injured cell. So the type of the cell. For example, if I have striated muscle of the leg and I have the cardiac muscle cells, both are muscles, but the striated muscle of the leg can accommodate complete ischemia for 2 to 3 hours without injury, while cardiac muscle will die only after 20 to 30 minutes of this ischemia. And so this type is important. Okay, I don't have anemia, I don't have a problem, nutritional problem, and so I have a good nutritional status. This can help the cell to withstand the injury, withstand the ischemia. But if the cell is deprived from nutrition due to any abnormality, this can make the effect of ischemia much higher. يعني الخلية اللي متغذية كويس فيها جلايكوجين ستور، فيها فات ستورز، دي هتقدر تستحمل الإسكيميا أكتر من الخلية اللي هي depleted من الجلايكوجين والفات ستورز. وبالتالي الستاتس of the cell, nutritional status of the cell هتبقى مهمة جدا في قدرتها على تحمل الانجري. Okay? Adaptability of the cell، قدرتها على الادابتيشن. If the cell can adapt, it will be much better. وبالتالي الخلية اللي هيحصل فيها شوية injury، شوية ischemia، هتقدر لو هي تقدر تعمل adaptation ممكن حجمها يصغر، يحصل لها atrophy من غير ما تموت. إنما لو الخلية ما تقدرش تعمل adaptation ده، if the cell cannot adapt, it can die. So if the cell can adapt, minor injury, okay, can lead to atrophy, for example. But if the cell cannot adapt, so this minor injury can kill the cell. So the adaptability of the cell will also change the cellular response to the injurious stimulus. Genetic makeup of the cell. يعني إيه genetic makeup? We have certain genetic makeup for each cell and certain enzymes that are present with a certain genetic conformation. Some cells have different genetic conformation of certain enzymes، فيها epitopes مختلفة وده بيخلي قدرتها على تحمل الانجري ممكن تختلف، قدرتها على تحمل دراج معين ممكن تختلف. يعني you can give a drug to 2 patients and this drug can lead to toxicity in one patient and nothing in the other patient. This results from some genetic makeup abnormality or difference between the two persons in a certain enzyme that can metabolize this drug. وهتاخدوا الكلام ده في الفارماكولوجي بالتفصيل. So the genetic makeup of the cell can also alter the cellular response to injurious stimuli. Fine. Look at this diagram. This is an ill cell. This is an injured cell. When the cell is exposed to injurious stimuli, it will undergo some changes. In each cell, you have an intact cell membrane like that. You have nucleus, you have organelles like that. What happens if the cell is exposed to injury? You may have loss of things outside the cell. تبتدي تفقد حاجات المفروض ما تخرجش منها. You may have entrance or influx of different chemicals that shouldn't be inside the cell. So if the cell is injured, it will lose the control. And so it can lose outside things and it can has influx of different things that it doesn't want. Next, it can have defects in the cell membrane. And these defects in the cell membrane will lead to release of the contents of the cell outside. And this is grave, of course. You can have even here destruction of the wall of the lysosomes, and these lysosomes contain a lot of lysosomal enzymes, and these lysosomal enzymes, when they are released into the cytoplasm, they will lead to digestion of the contents of the cell. And so if the cell is exposed to injury, many things, many changes occur to the cell. This can lead to efflux of certain substances, influx of certain substances, defects in the cell membrane with loss of contents outside, defects in the lysosomal membrane with release of the lysosomal enzymes inside the cell cytoplasm, leading to digestion of the contents of the cell. So we are going to explain these things in the form of the mechanisms of cell injury. So we have general biochemical mechanisms of cell injury, and these general biochemical mechanisms are responsible for the changes and the morphologic changes that we are going to explain later on in cell injury. We have 6 biochemical changes or mechanisms that lead to the cell injury, starting with ATP depletion, damage for mitochondria, loss of calcium homeostasis, generation of reactive oxygen species. All these 4 will lead to damage to the plasma membrane and the nucleus of the cell. So we have ATP depletion, damage of the mitochondria, loss of calcium homeostasis, generation of reactive oxygen species, and all these 4 mechanisms will lead to damage of the plasma membrane, cell membrane of the cell, and the cell nucleus. Okay, starting with ATP depletion. ATP depletion. ATP is like the gas for cars. If you don't have gas, the cars won't go. وبالتالي لو ما عندكش بنزين العربية مش هتمشي. لو ما عندكش ATP السيل مش هتشتغل. So ATP is important for the cell. If you don't have ATP, you can't have any work inside the cell. The cell work will stop. Every cellular process requires high energy phosphates of ATP. And so you need ATP for the life of the cell. From where do we bring ATP? ATP is produced through glycolysis. What is glycolysis? Glycolysis means degradation of glycogen. So you need to degrade glycogen to form ATP. And this degradation occurs through aerobic, in the presence of oxygen, aerobic, or anaerobic glycolysis. So we produce ATP through aerobic glycolysis in the form of oxygen, in the presence of oxygen, or anaerobic glycolysis in the absence of oxygen to produce ATP. Okay, presence of oxygen, so we do this in the mitochondria. So the aerobic glycolysis is the degradation of glycogen in the presence of oxygen inside the mitochondria. Okay, and anaerobic glycolysis is the degradation of glycogen in the absence of oxygen. Fine. Aerobic and anaerobic glycolysis are important to produce ATP. If I don't have aerobic or anaerobic glycolysis, this will lead to loss of ATP synthesis, and this will deprive the cell of energy. The rate and amount. Okay. The rate and amount of ATP loss will influence the rate and extent of cellular injury or death. If I have slow rate of loss plus low amount, I'm going to have what? I'm going to have mild form of reversible cell injury, for example. But if I have rapid loss and great amount of ATP, so I'm going to have severe injury, usually cell death. Okay, so the rate and amount of ATP loss will influence the rate and extent of cellular injury or death. The initial functional and morphologic consequences of decreased intracellular ATP during cell injury are like that. If you have ischemia like that, this is ischemia, where you have reduction of blood supply to the organ due to some defect in the artery. You have narrowing here in this artery, or you have obstruction in the artery like that, and so you don't have oxygen going to the mitochondria to produce ATP through oxidative phosphorylation, which is the aerobic glycolysis. Okay, so if you have ischemia or hypoxia, this will lead to decreased oxygen delivered to mitochondria, and this will lead to diminished or deficient aerobic glycolysis due to decreased oxidative phosphorylation, okay, occurring inside the mitochondria, and this will lead to decreased ATP amount inside the cell. What happens if you have decreased ATP amount inside the cell? الحقيقة عندي example مهم جدا. الكهرباء لو الكهرباء قطعت لمدة 3 ساعات، اوكي، وكان في واحد نائم، واحد تاني بيشتغل على الكمبيوتر، متوصل بالكهرباء، اوكي. لما الكهرباء قطعت، مين من دول هيتأثر؟ اللي نايم ولا اللي بيشتغل على الكمبيوتر؟ اكيد طبعا اللي بيشتغل على الكمبيوتر، اوكي. So if I have loss of electricity for 3 hours and I have 2 persons, one of them is sleeping and the other one is working on computer, which one will be affected by the loss of electricity? Of course, the working one. This occurs in our tissues and cells. The cells that are in a very active state will be affected by the loss of ATP more than the less active cells, okay? And inside each cell, the more active process that is going on all through the day will be affected more than other cellular processes that are not continuous all day long, okay? And so the first one to be affected by the ATP depletion is the sodium pump. What is the sodium pump? is the sodium pump? Okay, sodium pump is the guard. Okay, it is the guardian that is present on the cell membrane. Sodium pump here is present on the cell membrane, and this sodium pump is very important. Why? Because you have sodium outside the cell, you have water outside the cell, you have potassium inside the cell. Fine? You have sodium and water outside the cell, you have chlorine outside the cell, and you have potassium inside. Of course, you have an amount of sodium chloride and water inside, but regarding the concentration, the sodium, water, chlorine outside the cell have much higher concentration, okay, than inside the cell. Potassium is very high inside the cell as compared to potassium outside the cell. And so, if I'm going to leave sodium, water, chlorine, and potassium go through the cell membrane without controlling them, it will pass from the high concentration to the low concentration. So, sodium, chlorine, and water will go inside the cell by the osmotic gradient. Fine? And the potassium will go outside. So, if I'm leaving them without any control, this will happen. The sodium pump here works to, what happens if I leave it? The sodium, chlorine, and water going inside will lead to swelling of the cell. The cell will swell. If it contains a lot of sodium chloride and water, it swell until it ruptures. Okay? So the cell will swell until it ruptures. So I don't want to do this. So what I'm going to do is kicking this sodium and chlorine outside. So I'm going to, any sodium going inside by diffusion, it will be taken outside by the sodium pump. And any potassium going outside by diffusion will be taken inside by the sodium pump. And so the sodium pump gives sodium outside, and it brings potassium inside, okay, against concentration gradient. So this sodium pump works against concentration gradient, and so it needs energy. So it needs a lot of ATP to perform this function. The sodium pump dysfunction occurs due to ATP depletion. This is the first affected chemical process occurring in the cell. Sodium pump failure will lead to influx of calcium, influx of sodium, and influx of water. Also, calcium outside is present in high concentration. It goes inside by diffusion, and it is kicked outside by the sodium pump. And so if I have failure of sodium pump, I'm going to have influx of calcium, water, and sodium in great amounts. Okay, great amounts. I can't kick them out. Okay. And at the same time, we have loss of potassium outside. I have efflux of potassium outside. This goes with concentration gradient. Okay? And I cannot reverse them because the sodium pump is defective. This will lead to what? If I'm going to have a lot of sodium, a lot of water inside the cell, this will lead to swelling of the cell. The cell will swell, and all the organelles inside will also contain a lot of water and swell. So I'm going to have swelling of the organelles, endoplasmic reticulum, mitochondria, and so on. Cellular swelling, the cell as a whole will undergo swelling, and loss of microvilli or plebs. If I have microvilli with this swelling of the cell, I'm going to lose the functional functions present on the surface of the cell. I have loss of microvilli, and I can have some plebs like that until the cell can rupture from extensive swelling. So the first process to be affected by ATP depletion is failure of the sodium pump, and so the calcium, sodium, water, and potassium will move with concentration gradient. Influx of calcium, sodium, and water will occur, leading to swelling of the cell and the organelles, loss of microvilli, and presence of plebs on the surface, efflux of potassium outside. Okay, so this is the first effect of ATP depletion. Okay, okay. This is due to defect in aerobic glycolysis. Here, we have here aerobic glycolysis. Fine. So if aerobic glycolysis is defective due to decreased oxygen, so why don't I produce ATP by the other way? I'm going to produce ATP by anaerobic glycolysis. So this is the consequence of ATP depletion, increased anaerobic glycolysis inside the cell. This has consequences. Okay, it will give me some ATP, but this ATP is not enough. And the other thing, it will have complications or consequences. At first, I'm going to have depletion of my glycogen stores inside because I'm going to deplete them by this anaerobic glycolysis. This occurs inside the cytoplasm. And this anaerobic glycolysis will produce a lot of lactic acid. This lactic acid will lead to marked decrease in pH and sharp and marked decrease in pH of the cell, of the cytoplasm. This will lead to clumping of nuclear chromatin and sometimes can lead to denaturation or coagulation of the proteins present in the cytoplasm of the cell. So I have increased anaerobic glycolysis as a consequence of defective ATP formation by oxidative phosphorylation and aerobic glycolysis. This has consequences. It will give me some ATP, but it is not enough to maintain the cell for a long time. And at the same time, it produces some consequences in the form of depleted glycogen stores, increased lactic acid production, and this will lead to sharp marked decrease in pH of the cell, leading to clumping of nuclear chromatin and denaturation of proteins present in the cytoplasm. Okay? The last effect of ATP depletion results from swelling here present. Swelling present here. Okay? The swelling of the endoplasmic reticulum. The endoplasmic reticulum carries ribosomes on them, okay? And with this swelling, these ribosomes will go away like that. So I'm going to lose the ribosomes, okay? So the ribosomes will be detached from this swollen endoplasmic reticulum. And this detachment of ribosomes will decrease protein synthesis. You know that protein is synthesized from these ribosomes attached to the rough endoplasmic reticulum. So I have decreased protein synthesis, and this will lead to lipid deposition. And we will learn this again in fatty change later on. Okay, we are going to explain this later on in another lecture. And so the ATP depletion is very important. It results from decreased anaerobic glycolysis inside the cell due to the diminished oxygen delivered to the cell, and this diminished ATP will lead to sodium pump failure, leading to influx of calcium, sodium, and water inside the cell with efflux of potassium, and this will lead to cellular swelling, endoplasmic reticulum swelling, detachment of ribosomes, loss of microvilli on the surface. Increased anaerobic glycolysis as a compensatory mechanism to produce ATP will result in decreased glycogen stores, increased lactic acid, increased acidity of the cell. Sharp increase in acidity of the cell will lead to clumping of nuclear chromatin and can lead to denaturation of proteins present in the cytoplasm. The detachment of ribosome will decrease protein synthesis, and this will lead to lipid deposition, as we are going to know later on. Look at this. This is a cell, and this cell is affected here by ATP depletion. You can identify swelling of this cell like that. It is swollen, okay, swollen, and these organelles are swollen. Look at the endoplasmic reticulum, swollen, and the ribosomes are detached. You have some lipid present in here in the cytoplasm. Look at the surface. cell membrane shows these blips. These blips are present on the surface, and this cell, if it continues to swell like that, it will eventually rupture. Okay. The second biochemical process of cell injury is the mitochondrial damage. Of course, mitochondria is the factory of ATP synthesis by oxidative phosphorylation or aerobic glycolysis. So the mitochondria is very important for the life of the cell. And so we have this question to ask. Mitochondrial integrity is critical for cell survival. True or false? Of course true. If ATP is important for cell life, so the mitochondria will be very important to cell life. Not only mitochondria, but mitochondria in a full function and integrity. So the mitochondrial integrity is critical for cell survival. The mitochondrial damage occurs in most cellular injuries directly or indirectly. So each type of injury either goes directly to affect the mitochondria or affect something else, and this will affect mitochondria in an indirect way. We have damage of the mitochondria by increased cytosolic calcium. Why does cytosolic calcium increase? It increases due to influx of calcium without being kicked out by the sodium pump. The sodium calcium pump kicks calcium out. So if I have failure of the sodium pump, I have increased cytosolic calcium, and this increased amount of calcium will go directly and damage mitochondria. Oxidative stress. What is oxidative stress? It is the generation of reactive oxygen species, as we are going to explain in the next two slides. This increased reactive oxygen species will lead to damage of the mitochondrial membrane, and so I'm going to lose the integrity of the mitochondria. So I'm going to have cytosolic calcium increase, oxidative stress with production of reactive oxygen species. This will lead to mitochondrial membrane damage and loss of the integrity of the mitochondrial membrane, leading to a great problem in the cell. Vacuoles and calcium deposits are present in the mitochondria of injured cell. So inside an injured cell, look at the mitochondria, you will find swelling of the mitochondria, presence of vacuoles, and then we have calcium deposits inside the mitochondria, and these are signs of mitochondrial injury and cell injury. Remember that we have said in the first lecture that we have two forms of cell death, which are necrosis and apoptosis. Mitochondria actually is involved in both. So mitochondria is involved in necrosis and is involved in apoptosis. Okay? If I have in this look at this, if I have decreased oxygen supply, which is oxygen deprivation, if I have toxins or radiation, these causes will go directly to damage mitochondria. So I have direct damage of mitochondria through decreased oxygen supply, toxins, radiation, and remember that decreased oxygen supply will lead to increased calcium, okay? And this increased calcium will go directly and damage the mitochondrial membrane. So I can have direct damage of the mitochondrial membrane by increased calcium due to decreased oxygen supply, or direct damage by toxins or radiation. This direct damage to the mitochondrial membrane, okay, internal membrane and external membrane, will lead to dysfunction of the mitochondria. And so what happens if I have dysfunction of the mitochondria? I'm going to have decreased oxidative phosphorylation and decreased ATP generation. And at the same time, I have increased production of reactive oxygen species. These reactive oxygen species are, as we are going to explain in some next slides, they are produced normally during oxidative phosphorylation in small amounts. But if I have defect in oxidative phosphorylation, I'm going to produce large amounts of reactive oxygen species. These marked amounts of reactive oxygen species plus decreased ATP due to decreased oxidative phosphorylation will lead to multiple cellular abnormalities ending in cell death by necrosis. And so this is the mitochondrial mechanism of damage that will lead to necrosis after exposure to toxins, radiation, or decreased oxygen supply or oxygen deprivation. So I have mitochondrial membrane damage or dysfunction leading to decrease in the normal function of the mitochondria, which is ATP generation. So there will be decreased ATP with all consequences of ATP generation decrease. And at the same time, we have abnormal oxidative phosphorylation leading to increased production of reactive oxygen species. Both will lead to multiple cellular abnormalities ending in necrosis or cell death by necrosis. The other form of cell death is apoptosis, and mitochondria is also involved in apoptosis. How? In cases of decreased survival signals to the cell, DNA damage or protein damage beyond the ability of the cell to repair them, we cannot repair them, okay? This will lead to death of the cell by apoptosis. How? So I have proteins that control the process of apoptosis present on the mitochondrial membrane. Some of them are stimulatory for apoptosis and others are inhibitory of apoptosis, as we are going to explain in apoptosis. If I have loss of survival signals or I have DNA or protein damage beyond the ability of the cell to repair them, I'm going to increase the proteins that help apoptosis and stop the anti-apoptotic proteins, and this will lead to escape of some components of the mitochondria outside. I have leakage of the mitochondrial proteins through some of these pores present on the mitochondrial membrane, and this leakage of mitochondrial proteins will stimulate the cascade of apoptosis. Okay, and again we have mitochondria involved in the other form of cell death, which is apoptosis, but with different causes or different stimuli in this case: decreased survival signals, DNA, or protein damage. Fine. So the mitochondria is involved in the process of necrosis and is involved in the process of apoptosis. So it is a main mechanism in the death, that is by necrosis or by apoptosis. Loss of calcium homeostasis. Normally, free cytosolic calcium is maintained by ATP-dependent calcium transporters like that sodium pump. So I have a calcium pump like that, like the sodium pump. Why? Because intracellular cytosolic calcium is less than the extracellular calcium by 1 to 10,000. We have a very high concentration of calcium outside. So by concentration gradient, calcium goes inside in large amounts. Okay? because it is pushed inside by the concentration gradient. But what kicks calcium outside? It is the ATP dependent calcium pump. ATP dependent calcium pump, like that of sodium pump, sodium calcium pump. Okay. Small calcium stores are present in the mitochondria and endoplasmic reticulum in the normal status. In cases of injury due to ischemia or certain toxins, I have what? I have loss of calcium pump, and this will lead to net influx of extracellular calcium across the plasma membrane, along with release of these stores. So I have excess of calcium due to influx of calcium in great amounts, and also release of the intracellular stores inside the cytoplasm. What is the effect of that? I have increase in the calcium present in the cytoplasm due to this influx and due to the release of calcium stores from endoplasmic reticulum and mitochondria. This calcium inside will lead to what? It will lead to activation of all enzymes. So calcium influx will lead to activation of all enzymes. Anything with A's will be activated. So I have activation of ATPase, phospholipase, protease, endonuclease, and caspase. So I have activation of all A's. All enzymes will be markedly activated, leading to consequences. ATPase will lead to destruction of ATP, lead to more depletion of ATP. Phospholipase will destroy phospholipids, and these phospholipids are present in the membranes. So phospholipids are present in the membrane, cell membrane, and membranes of the organelles. Okay, so if I have phospholipase, I have destruction or decrease in phospholipids present in the membrane and the organelle membranes. Protease will destroy the cytoskeletal protein, okay, and the membrane, the protein present in the membrane. So protease will help in destruction of the membranes present in the cell membrane and in the organelles also, plus cytoskeletal proteins. Endonuclease will destroy the nuclear chromatin. So I'm going to destroy the nuclear chromatin by the endonuclease. Caspase will be also activated, and this helps in apoptosis. So increased cytosolic calcium will activate many enzymes. This will lead to more ATP depletion, destruction of the membrane, cell membrane, and membranes of the organelles through activation of phospholipase and protease, destruction of the nuclear chromatin through activation of endonuclease, and activation of caspase that can lead to apoptosis. So calcium influx can lead to necrosis by all these enzymes activated, and can lead also to apoptosis by activation of caspase. So this is the role of calcium influx. What are the reactive oxygen species? ROS, reactive oxygen species. During normal respiration, we have oxidation, reduction, reactions. So we have oxidation, reduction, reactions. Of course, oxygen will lead to oxidation of other components, and at the same time it is reduced. Okay, so the oxygen is reduced and it leads to oxidation of other components. Fine. In oxidation, there is loss of electrons. In reduction, there is gain of electrons. And so when oxygen is reduced, it gains electrons from other components. Okay, usually oxygen gains 2 electrons to be in the last orbit. Okay, so we have 2 electrons present in the last orbit of the stable oxygen after reduction. But what happens if this is not the issue? If I have incomplete reduction, this means that the oxygen takes, instead of taking 2 electrons, it takes only 1 electron from the other components. So this is incomplete reduction, and this will lead to generation of unstable radicals that are called oxygen-free radicals. And so incomplete reduction means that the oxygen, instead of gaining 2 electrons, and so I have 2 electrons in the last orbit, okay, and this gives the oxygen, the reduced oxygen stability, I have incomplete reduction of this oxygen molecule, and so it gains only 1 electron from the other components, and this will lead to the generation of unstable radicals that are called oxygen-free radicals. Okay, for example, we have what is called superoxide and hydroxyl radicals. Hydroxyl radicals. Fine. So what are the oxygen-free radicals? These are unstable radicals having a single unpaired electron in the last orbit. They are unstable and they need another electron to be stable. And so they take this electron from any other material, protein, lipid, DNA, and so on. So for oxygen-free radicals to gain stability, they need another electron, so they go and steal this electron from another. So when they are unstable like that, they go and steal another electron, okay, from another material like protein or lipid or DNA. When they take this electron, they become more stable because they become having 2 electrons in the outer orbit, okay? But they create a problem because they lead to oxidation of other components like protein, lipid, and DNA when they lose the electron, and they become having 1 unpaired electron in their outer orbit, so they transfer into free radicals. So the free radicals actually causes a consequent injury, not a single one, because when they steal the electron, leading to oxidation of other compounds like protein, lipid, and DNA, they lead to generation of other free radicals by stealing this electron from these components, and so they transfer into free radicals, and this lead to cascade of oxidation reactions leading to destruction or damage of proteins, lipids, and DNA. Okay, so this is the story of the oxygen-free radicals. Reactive oxygen species. What are the reactive oxygen species? During oxidation, during respiration, we have oxidation, reduction reactions. They depend on the presence of oxygen. Oxygen oxidizes other components and it is reduced at the same time. So oxygen leads to oxidation of other components and it is reduced. Okay? Reduced. By oxidation, This means loss of electrons, and reduction means gain of electrons. And so oxygen during respiration gains electron from other components. Okay? Complete reduction of oxygen is important for the stability of oxygen. By complete reduction, oxygen atom gains 2 electrons in the last orbit from other components. Okay? So this is the complete reduction, and so this is the reduced occurs by gaining only 1 electron, the other one is absent, so I'm going to have an unstable radical that has a single unpaired electron in the outer orbit. This is a totally unstable radical because it needs another electron to gain the stability. Okay? If it is unstable, it does what? It goes and steals an electron from any other material or component present in the cell. So it steals another electron from lipids present in the membrane, proteins present in the endoplasmic reticulum, or from DNA present in the nucleus. So it steals this electron, the deficient electron, and after stealing this electron, it becomes a stable one, okay? It becomes stable, but after stealing this electron leads to oxidation of other components, incomplete oxidation, losing 1 electron, and they transform to other radicals, transform to free radicals also. And so when they transform to free radicals, whether lipids, proteins, and DNA, they become more they try to take the electron from other components and so on, and this will lead to cascade of damage. Okay, so these are the free radicals. The free radicals include this superoxide and hydroxyl radical plus H2O2, which is not a radical. Hydrogen peroxide is not a radical, but it transforms to superoxide and hydroxyl. If it is not transformed to water, it will go back to form these radicals. So together they are called reactive oxygen species: superoxide, hydroxyl, and H2O2. The oxygen free radicals plus H2O2 are called together reactive oxygen species. Many stimuli induce injury via the generation of these ROS, including radiation, inflammation, oxygen toxicity, chemicals, reperfusion, and so on. Okay? What are these free radicals? As we have said, these are chemical species with a single unpaired electron in the outer orbit. They have a single electron in outer orbit. To gain stability, they need another one. They are normally produced during mitochondrial respiration in small amounts, and they are degraded by defense mechanisms. Why? Because if they are not degraded, they are going to go and steal the electron and cause oxidation of other components in the cell, leading to their damage. So we get rid of them to avoid this oxidation and damage of other components in the cell. If you look at this figure, we have, this is a mitochondria in which oxygen undergoes a reduction in oxidative phosphorylation. If there is incomplete reduction due to exposure to inflammation, radiation, chemicals, or reperfusion, what happens to this oxygen? It will be incompletely reduced and forms what is called superoxide. This superoxide is transformed by superoxide dismutase into hydrogen peroxide inside the mitochondria. Hydrogen peroxide, if it is not transformed into water, it will transform into hydroxyl radical in the presence of iron or copper by what is called Fenton reaction. This hydroxyl radical can transform into H2O2 by glutathione peroxidase enzyme. Okay, so the reactive oxygen species represent superoxide, hydroxyl radical, and hydrogen peroxide. The normal defense mechanism that help us to remove the free radicals are called the antioxidant mechanisms. If these free radicals are not removed, they will go to the lipids present in the membrane, leading to peroxidation of these lipids. Look at this, and this peroxidation will lead to generation of free radicals from these lipids, leading to a consequent lipid peroxidation and membrane damage. Okay, if they go to proteins present inside the endoplasmic reticulum, they can lead to misfolding of proteins and even damage of the proteins. If they go to the DNA present in the nucleus, will lead to breaks in the DNA, and during repair, this can lead to mutations. So I have membrane damage by lipid peroxidation. Oxidation of proteins lead to loss of enzymatic activity and protein malfolding. DNA damage will lead to mutations. Membrane damage and defects in plasma membrane permeability. The previous four mechanisms, including ATP depletion, calcium influx, mitochondrial damage, and reactive oxygen species mediated damage, all are responsible for damage of the membrane, including the cell membrane and including the membrane of the organelles, with subsequent defects in plasma membrane permeability. Also, they cause nuclear previous four mechanisms. Membrane damage and defects in plasma membrane permeability. What are the causes? We have calcium-mediated phospholipase activation and protease activation. And this calcium-mediated phospholipase and protease activation will lead to destruction of the phospholipids or degradation of the phospholipids present in the membrane, and also of the cytoskeletal proteins that support the membrane. And so calcium-mediated phospholipase and protease activation will lead to membrane damage. Lipid peroxidation by oxygen-free radicals, as we have said previously, that oxygen-free radicals go and steal their electron that is missing from their outer orbit from any other component in the cell, including the lipid present in the cell membrane, leading to lipid peroxidation. And this lipid peroxidation will lead to a chain of damage reaction in the cell membrane, because each of these fatty acids that loses the electron will try to take it from another one, and so on, and this will lead to membrane damage. Lastly, ATP depletion with decreased phospholipid synthesis. In ATP depletion, it is important for protein synthesis and synthesis of important components of the cell, including the phospholipids. So if I'm going to lose phospholipids by calcium-mediated enzyme activation and by lipid peroxidation by oxygen-free radicals, I need to compensate by new synthesis. If I don't have ATP, so I'm not going to compensate what I lost, and this therefore ATP depletion will help in membrane damage in an indirect way. If you look at this diagram, we have here the mechanisms of membrane damage in cell injury. We have here increased cytosolic calcium. This will lead to enzyme activation, phospholipase and protease. Cytoskeletal damage will decrease the support of the membrane. Increased phospholipid degradation will lead to lipid breakdown, okay, and this will lead to membrane damage. Also, reactive oxygen species will lead to lipid peroxidation, and this will lead to phospholipid loss and membrane damage. We need to compensate by new synthesis of phospholipid, but actually, due to the absence of oxygen and ATP depletion, this will prevent the phospholipid synthesis, which goes with phospholipid loss. And lastly, we have the membrane damage. What are the consequences of membrane damage? The cell membrane defects will lead to loss of osmotic balance. So the osmotic balance is, we need an intact cell membrane to keep the osmotic balance between the inside and outside the cell. Loss of membrane barriers leads to breakdown of concentration gradients of metabolites necessary to maintain normal metabolic activities. We need a concentration, there is a normal concentration gradient between the components outside and inside the cell, for example, sodium, chlorine, water, and so on. With this loss of the membrane barriers, I have breakdown of these concentration gradients of these different metabolites that are necessary to maintain normal metabolic activities, and this will stop these normal metabolic activities. Then if we have defects in the membrane, okay, if we have some defects in the cell membrane, so we have open cell membrane like that, so we have loss of proteins and vital metabolites outside the cell, and so we have leakage of vital metabolites and loss of proteins. This will lead to depletion of energy stores from the cell. All these are related to damage in the cell membrane itself. We have other effects related to damage of the membrane of different organelles. On the top of the list, we have the mitochondria. And we all know that the mitochondria is the factory of ATP, and it is very important and vital to the cell. If we have damage in the membrane of the mitochondria as a part of damage of the cell membrane by any of the previous mechanisms, we have what? We have leakage of cytochrome C triggering apoptosis, and we have ATP depletion. These are the defects that result from mitochondrial damage. Then loss of normal function, which is ATP. So we have ATP depletion, we have ROS production, increased ROS production, and sometimes we have leakage of cytochrome C, and this will initiate apoptosis. Also, we have what is called lysosome. You all know that lysosomes in the cell have enzymes inside. We have enzymes inside the lysosomes, but they are kept all through inside the lysosomes, and they don't go away to the cytoplasm. If I have defects in the lysosomal membrane, so I have escape of these enzymes to the cytoplasm, then they will start to act on the constituents and leading to digestion and degradation of the constituents of the cell. So after cell death, cellular constituents are digested by lysosomal hydrolase enzyme. These dead cells may be replaced by large walled phospholipid masses. Of course, you have the cell membrane, and the damage of the membranes, including the cell membrane, as well as the organelle membrane will lead to the breakage of phospholipids. These phospholipids will form these whorled masses like that. Okay, we have these whorled masses that are present, and they represent damage of phospholipids from the membrane. So these phospholipid masses are called myelin figures. What is myelin? Myelin is the surrounding sheath that is formed of lipid components, and it surrounds the axons in nerves. So I have in the nerve axons here we have myelin surrounding the axons in myelinated nerve fibers. طبعا احنا عارفين النيرف فايبرز وعارفين المايلين. المايلين ده لما بنيجي نصبغه بالstains for electron microscope, when we use the electron microscopic stains, this myelin is fat, and so it takes the lead and it appears very dark or black in color. Also, the phospholipids are lipids, and so when we go and stain these the cells by lead for electron microscopy ultrastructure, they also stain black, and they look like myelin, and so they call them myelin figures. So I have the myelin figures. If you look at this picture, here is a dying cell, and with this dying cell I have damage of the membranes, including the cell membrane and the organelle membrane, with formation of these whorled masses like that. These are the whorled masses. They are black in color, and they remind you of the myelin. This is a nerve. Below this is a nerve, and this nerve contains these axons, and these axons are surrounded by this black myelin. And so these figures that are formed of phospholipid masses inside the dying cells or the injured cells look like the myelin present in the nerve, so they call them myelin figures. Of course, they start to appear when there is some damage of the organelles, but when this damage is severe and the cell is dead, and I have rupture of the membrane, so the membrane will transform into a lot of myelin figures, so they become frequent in irreversible cell injury. These phospholipid masses are phagocytosed by other cells or degraded into fatty acids. They are phospholipids, and so they can be degraded into fatty acids by the enzymes, or they are phagocytosed by other cells, adjacent cells. With the escape of the enzymes from the damaged membrane, I have enzymes that are kept inside each cell. These are cell-specific isoenzymes. When they escape into blood due to the damage of the membrane, they start to increase in the level in blood, and so I can measure them. And they can reflect the damage of the cell. So if I have, for example, damage in the liver cells, I have increase in these enzymes in the serum, ALT, AST, and alkaline phosphatases. These enzymes will increase in the serum, and they reflect that there is damage in the liver cells. Also, when I have damage of the cardiac muscle cells, as in case of myocardial infarction, which is death of part of the wall of the heart, I have what? I have release of the isospecific enzymes, including creatine kinase and troponins from the cardiac muscle cells into the serum. So if I'm having damaged myocardial fibers in myocardial infarction, I have release of creatine kinase and troponins in the serum, and if I find them in high levels, I'm going to make sure that there is death of myocardial fibers. Lastly, we have nuclear damage, and we have said that the previous 4 mechanisms of injury, including ATP depletion, mitochondrial damage, calcium influx, and reactive oxygen species mediated damage, they go and damage the cell membrane and the nucleus. The nuclear damage here results from the activation of lysosomal enzymes such as proteases and endonucleases. So these lysosomal enzymes like proteases and endonucleases will lead to irreversible nuclear damage. The nucleus is the site of life of cell. So if I'm having no nucleus, I'm having a dead cell. What happens to the nucleus? Look at this. These are living cells. The nucleus has details. If I have the nucleus, I have inside chromatin, I have nucleolus, and I can see the details of the nucleus. So this is a living nucleus. Look at this. This nucleus in this cell is dark and black. You can't see anything from the components of the nucleus. So it is shrunken and becomes very dark, okay? And you can see any details. This is called pycnosis. So pycnosis, the nuclei are condensed and dense. You can see any details. Then this pycnotic nucleus will fragment like this. So it will be fragmented, dark nucleus, and this is called karyopyxis. Then we have total hydrolysis of the nuclear components, and then I have no nucleus. It is clear, so this is called karyolysis, absence of the nucleus. So the nuclear changes include pycnosis, which means nuclear shrinkage, increased basophilia, and the DNA condenses into a solid shrunken mass with no details, no nuclear details under this dark nucleus. So this is called pycnosis. Karyopyxis means fragmentation of the pycnotic nucleus, like this one. And lastly, we have total absence of the nucleus, which is karyolysis. Basophilia of chromatin fades as a result of increased DNA's activity, and this will lead to total absence of the nucleus, which is called karyolysis. Of course, if I have pycnosis, karyopyxis, or karyolysis in one cell, so this cell is dead. If I have breaks in the plasma membrane of the cell, this cell is dead. These are two signs of cell death. They are signs of irreversible damage. The persistence of ischemia or hypoxia results in irreversible damage of the structure and function of the cell. So if I have persistence of ischemia or hypoxia, I'm going to have cell death. The inability of the cell to reverse mitochondrial dysfunction is very important. The mitochondrial dysfunction is important because the mitochondria is the source of ATP. So if I'm going to have progressive mitochondrial dysfunction and I cannot reverse them, so I'm going to go into cell death. Disruption of the cell membrane and nuclear damage are characteristic of cell death. So these are the morphological features that make you sure that the cell is dead. Disruption of cell membrane and nuclear damage are the important characteristic signs of cell death. If we go to this diagram to see what is the relation between the different biochemical changes or biochemical routes by which cell injury occurs, we can see here mitochondrial damage, ATP depletion, ROS, calcium influx, then membrane damage and nuclear chromatin damage. Do we have a relation between them? Look at this. Calcium ATP depletion will lead to calcium influx by impairing the function of calcium pump. ATP depletion will lead to mitochondrial damage. ATP depletion will lead to membrane damage because there is deficient phospholipid synthesis. Mitochondrial damage will lead to ATP depletion, of course. Mitochondrial damage can lead to caspase activation and apoptosis. In certain conditions, mitochondrial damage can lead to increased ROS production due to bad or insufficient oxidative phosphorylation with the release of big amounts of ROS. Calcium influx will lead to activation of all enzymes, including ATPase, leading to more ATP depletion, protease and phospholipase, leading to mitochondrial damage and membrane damage, endonuclease, leading to nuclear chromatin damage, and caspase can lead to apoptosis. Mitochondrial damage, as we have said, lead to defective oxidative phosphorylation with the release of ROS. The ROS will lead to lipid peroxidation, leading to damage of the membranes, membrane damage and mitochondrial damage. It will lead to DNA oxidation with nuclear chromatin damage, and it will lead to protein oxidation, leading to protein misfolding, and this can lead to cell apoptosis. So I have cell death by apoptosis. This can be initiated by ROS, by protein misfolding, can be initiated by calcium influx due to caspase activation, and can be mediated by mitochondrial damage leading to caspase activation. The other forms of membrane damage and nuclear chromatin damage will lead to necrosis. Have a small test. The consequences of calcium influx into the cell include all of the following except: do we have disruption of the membrane? Yes. Why? Because we have phospholipase and protease activation. Do we have nuclear chromatin damage? Yes, because we have endonuclease activation. Do we have increased ATP? No, we have ATP depletion due to ATPase activation. Do we have induction of apoptosis? Yes, through caspase activation. So it will be increased ATP. A 54-year-old man has sudden onset of severe sharp chest pain with diaphoresis, increased sweating, and dyspnea, inability to breathe. ECG changes suggest the possibility of focal myocardial damage involving the left lateral ventricular wall. Which of the following laboratory tests on the patient's serum is most useful in this situation? If I have focal myocardial damage, do you think that I'm going to use cholesterol, creatine kinase, triglyceride, amylase, or sedimentation rate? Of course, we have creatine kinase, because if I have damage of the myocardial cells, I have release of creatine kinase in blood or troponins, and this will increase in the serum, and this will make you sure that focal myocardial damage occurred. Let's solve this magic question. Mitochondrial damage. Pycnosis means myelin figures are reactive oxygen species cause, increased cytosolic calcium causes, cell membrane damage. Yes, mitochondrial damage leads to H, leakage of cytochrome C initiating apoptosis. Pycnosis means what? Yeah, condensed clumped nucleus. Myelin figures are very good phospholipid masses due to membrane damage. Reactive oxygen species cause oxidation of everything, so F, oxidation of lipid, protein, and DNA. Increased cytosolic calcium causes what? What? ATPase and phospholipase activation, any ACE activation. Cell membrane damage will lead to what? Leakage of vital metabolites, C. Very good. So in summary, the mechanisms of cell injury include ATP depletion, failure of energy-dependent functions leading to reversible injury. ATP depletion, failure of energy-dependent cellular functions, ultimately necrosis, and under some conditions, leakage of proteins that cause apoptosis. Influx of calcium, activation of enzymes that damage cellular components and may also trigger apoptosis by activation of caspase. Accumulation of ROS, covalent modification of cellular proteins, lipids, and nucleic acids in the form of oxidation. Increased permeability of cell membranes may affect plasma membrane, lysosomal membranes, mitochondrial membranes, typically culminates in necrosis. Nuclear damage in the form of pycnosis, karyorrhexis, and karyolysis, and they are signs of cell death. Thank you.